Calories are a unit of measurement that represent the amount of energy that food provides to the body when it is digested and metabolized. When people consume more calories than their body needs, the excess calories are stored as fat, which can lead to weight gain and other health problems. In general, consuming more calories than the body needs can contribute to obesity, which is associated with a range of health problems, including diabetes, heart disease, and certain types of cancer. Conversely, consuming too few calories can lead to malnutrition and other health problems. It's important to note that not all calories are created equal. Different types of foods can have different effects on the body, even if they contain the same number of calories. For example, a high-calorie meal that is high in saturated fat and added sugars can be less healthy than a lower-calorie meal that is rich in nutrients and fiber. When we eat, our body converts the food into energy through a process called metabolism. Metabolism involves the breakdown of carbohydrates, proteins, and fats into smaller molecules that can be used by the body to fuel its various functions, such as muscle contraction, breathing, and digestion. The amount of energy that the body requires to perform these functions varies from person to person and depends on a variety of factors, including age, sex, height, weight, and activity level. Calories are a measure of the amount of energy that food provides. In general, the more calories a food contains, the more energy it provides to the body. When people consume more calories than their body needs, the excess calories are stored as fat. Over time, this can lead to weight gain, which can increase the risk of developing health problems such as type 2 diabetes, heart disease, high blood pressure, and certain types of cancer. It's important to note, however, that not all calories are created equal. Different types of foods can have different effects on the body, even if they contain the same number of calories. For example, a high-calorie meal that is high in saturated fat and added sugars can be less healthy than a lower-calorie meal that is rich in nutrients and fiber. In general, it's recommended that adults consume between 1,600 and 2,400 calories per day, depending on their age, sex, height, weight, and activity level. Consuming fewer calories than the body needs can lead to weight loss, while consuming more calories than the body needs can lead to weight gain. To maintain a healthy weight, it's important to consume a balanced diet that includes a variety of foods from all the major food groups, including fruits, vegetables, whole grains, lean proteins, and healthy fats. It's also important to limit the consumption of foods that are high in calories, saturated fat, and added sugars, such as fast food, sugary drinks, and processed snacks. As mentioned earlier, the body requires a certain amount of energy to perform its various functions. This energy is measured in calories. The number of calories that a person needs depends on several factors such as their age, sex, height, weight, and activity level. When a person consumes more calories than their body needs, the excess calories are stored in the body as fat. Over time, this can lead to weight gain and potentially to obesity, which is a serious health concern. In addition to increasing the risk of developing health problems such as heart disease, type 2 diabetes, and certain types of cancer, obesity can also affect a person's mental health and quality of life. On the other hand, consuming too few calories can also be harmful to health. When the body does not receive enough calories to meet its energy needs, it begins to break down its own tissues for energy. This can lead to muscle loss, weakness, fatigue, and other health problems. In addition, a prolonged period of low-calorie intake can lead to malnutrition, which can have serious long-term effects on health. It's important to note that not all calories are created equal. The quality of the calories consumed can also impact health. For example, foods that are high in added sugars and saturated fat can be high in calories but low in nutrients. This can contribute to weight gain and other health problems. On the other hand, foods that are high in fiber, protein, and healthy fats can be more nutrient-dense and may be beneficial for overall health. In general, a balanced diet that includes a variety of nutrient-dense foods is recommended to support overall health and well-being. This can include fruits, vegetables, whole grains, lean proteins, and healthy fats. Portion control and moderation are also important when it comes to managing calorie intake. In addition to the quantity and quality of calories consumed, other factors can also impact how calories affect the body. These factors include the timing of meals, the type of physical activity performed, and the individual's metabolism. Studies have suggested that the timing of meals can impact weight management and overall health. For example, some research suggests that consuming most of one's calories earlier in the day, rather than later in the day, may be more beneficial for weight management and overall health. Similarly, intermittent fasting, which involves limiting food intake to certain hours of the day or certain days of the week, has been shown to have potential health benefits such as improved blood sugar control and reduced inflammation. Physical activity is also an important factor when it comes to how calories affect the body. Regular exercise can help burn calories and improve overall health. Different types of physical activity, such as cardio and strength training, can also have different effects on the body. For example, cardio exercises such as running or cycling can help burn calories and improve cardiovascular health, while strength training can help build muscle mass and improve metabolism. Individual differences in metabolism can also impact how calories affect the body. Metabolism refers to the processes by which the body converts food into energy. Some people may have a faster metabolism than others, which can impact how quickly they burn calories. Factors such as age, sex, and genetics can also impact metabolism. There are various recommendations regarding calorie intake and dietary patterns that can help individuals maintain a healthy weight and overall health. Here are some key recommendations. Caloric intake: the number of calories a person needs per day depends on several factors, including age, sex, height, weight, and activity level. In general, an average adult male needs around 2,500 calories per day, while an average adult female needs around 2,000 calories per day. However, individual needs can vary. It's important to note that consuming too many or too few calories can impact health. Consuming too many calories can lead to weight gain and health problems, while consuming too few calories can lead to malnutrition and other health problems. Dietary patterns: the Dietary Guidelines for Americans recommends a dietary pattern that includes a variety of nutrient-dense foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. The guidelines also recommend limiting consumption of added sugars, saturated fats, and sodium. A plant-based diet that includes a variety of fruits, vegetables, whole grains, legumes, nuts, and seeds can be particularly beneficial for overall health. Portion control: in addition to choosing nutrient-dense foods, portion control is also important when it comes to managing calorie intake. Eating larger portions can lead to consuming more calories than the body needs. Learning to recognize appropriate portion sizes and practicing mindful eating can help support portion control. Physical activity: regular physical activity is an important part of maintaining overall health and well-being. The American Heart Association recommends at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, in addition to muscle strengthening activities at least 2 days per week. Hydration: staying hydrated is also important for overall health. The Institute of Medicine recommends a daily intake of around 3.7 liters of fluids for men and around 2.7 liters of fluids for women, including fluids from both food and beverages. In conclusion, calories are a measure of the energy obtained from food and beverages. Consuming excess calories can contribute to weight gain and health problems, while consuming too few calories can be harmful to health. Understanding how calories in food affect the body is an important part of maintaining overall health and well-being. It's recommended that individuals aim to consume a balanced diet that includes nutrient-dense foods, portion control, and regular physical activity. The number of calories a person needs per day depends on several factors, including age, sex, height, weight, and activity level. A dietary pattern that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats can be particularly beneficial for overall health. It's important to consult with a healthcare provider or registered dietitian for personalized recommendations based on individual needs and health status. By following these recommendations, individuals can support their health and well-being over the long term. Subscribe for more tips about your health.